Hello students, welcome to EPG Pathshala. I am Monica Saini from Department of Anthropology, University of Delhi. Today I will talk about the module Establishment of Partial and Complete Identity from Decomposed and Mutilated Bodies under the Forensic Anthropology paper. Through this module, you will be able to define the medico-legal importance of personal identification, the determination of identity of mutilated as well as decomposed remains. The students will also be able to derive identification of highly decomposed remains, and they will be able to establish identity through partial evidences. Forensic anthropology, defined as the application of science of physical anthropology to the legal process. The term forensic refers to the gathering of scientific physical evidence for use in a court of law, and anthropology is the study of behavior, origin, and physical and social development of humans. Thus, forensic anthropology is the use of anthropology to gather and examine the scientific evidence. Forensic anthropologists, they use a blend of science such as biology, chemistry, physics, anatomy, criminology, medical jurisprudence, and forensic medicine to aid in the investigation of crimes. According to the Charles Snow, the forensic anthropology is the application of physical anthropologist specialized knowledge to human, sexual, racial, age, and individuals' unusual variation to the problem of medico-legal jurisprudence. According to the Thomas Stewart, forensic anthropology as that branch of physical anthropology which, for forensic purpose, deal with the identification of more or less skeletonized remains known to be or suspected of being human beyond the elimination of non-human element. According to the Jubileker, the forensic anthropology is the application of the science of physical anthropology to the legal process for the identification of skeletonized remains and related legal structure. The forensic anthropology primarily perceive and explain the theories on personal identification and assess the difficulties and relevance of personal identification in a multicultural and biologically heterogeneous context. The forensic anthropology follow correctly the procedure of personal identification through anthropological methods and techniques. They also estimate correctly the age, sex, and time of the person involved, predict the identity of an individual to his or her socio-cultural, ethnic, caste, tribal group based on the various cultural and biological markers. And the forensic anthropology also employ the anthropological concepts and techniques in establishing the identities through skeleton, fragmentary, and decomposed remains. Thus, forensic identification or personal identification is the mainstay of forensic investigation. Forensic identification is the subfield of forensic anthropology. It is the process of applying scientific methods to identify humans, or products for use inside a courtroom. The definition of term forensic is for the courts. Therefore, one of the main purposes of forensic identification is to preserve evidence and the findings that can be drawn from the crime scene or the scene of an accident for use in a courtroom. It is useful to distinguish between the evidence and the individual. Identification in the living person is required in civil courts in case of impersonation in order to unlawfully secure property, life insurance payments, or to a prolonged, a lapsed pension, insurance claim, marriage, inheritance, passport, missing persons, and in case of disputed sex, whereas the identification of dead or non-living person is essential or required in case of fire, explosives, bomb blast injuries, railway accidents, foul play, flood, earthquake, war, etc. It is foremost important to identify the decomposed and mutilated bodies and also the skeletal remains. The two types of identification. The first one is complete or absolute identification. Complete identification implies the absolute fixation of the personality and the determination of the exact place in the community occupied by the individual, whereas the incomplete or partial identification means ascertainment of only some facts about the identity, such as race, age, sex, stature, while others are still remain unknown. Now, I will tell you about the data which assist in the establishment of partial and complete identity from decomposed and mutilated remains. The identification of decomposed and mutilated remains from any recovered characteristics such as skeletal parts or any bone or any identification marks from the decomposed remains or any unique morphological characteristics particular to an individual will provide help by supplying certain facts or data which might be useful in establishment of partial and complete identity of the deceased individual. Primary physical characteristics are those characteristics which are very difficult for a person to change during life, and they are referred as primary physical characteristics such as race, sex, age, stature, whereas secondary physical characteristics, they can be changed during life either deliberately by deceased or as a result of medical or dental interference. These characteristics can be identified in decomposed remains and also in the mutilated remains if the soft part for examination is retained. such as external peculiarities and somatoscopic observations. The first important primary physical characteristic is race. Complete identification of race from decomposed and mutilated remains is almost always impossible, but if soft parts are available, then partial identification of race is possible through careful examination of clothing, complexion, eyes, hairs, teeth, and feet. The next important characteristic of identification, that is sex. From decomposed remains, establishment of sex was determined by examining the presence of uterus, which is a proof of female sex, as it can resist decomposition for long time. Forensic experts examine primary and secondary sex characteristics if available, and they will possibly establish the gender with high accuracy. In case of mutilated remains, when body is cut into many pieces, establishment of identity is simplified when those parts bearing sexual characters are available, such as skull, pelvis, or long bones. The establishment of partial identity can be done from skull fragments, which includes the size of the skull and weight, texture of the skull, skull vault, that is curved in males and flattened in case of females. The partial identity establishment can also be done with the shape of orbits, that is squarish lower, relatively smaller in case of males, and rounded higher and relatively larger in case of females. The identity establishment can also be done with supraorbital ridges, glabella, forehead, mastoid process, styloid process, that is large and massive in case of males and small in case of females. Parietal eminences is also an important characteristic to differentiate between male and females. These parietal eminences are less prominent in case of males, and it is more prominent and projecting in case of females. The other important characteristics which are used for demarcation between males and females are occipital condyles, foramen magnum, cheekbones, occipital area, teeth, that is larger in size, lower molar often have 5 cusps in case of males and smaller in size, and lower molar often has 4 cusps in case of females. Zygomatic arch, which is strong in males and weak in females. Neurocranium, that is less arched, or mid-sagittal arc is shorter in comparison to the basal length in males, whereas it is highly arched in case of females. The last important characteristics which is used for differentiation between males and females is nasal aperture, and this nasal aperture is higher and narrower with sharp margins in males, and it is smaller with somewhat rounded margins in case of females. The establishment of sex is also possible by examining the pelvis. The important characteristics which are used for differentiation in males and females are the pelvis as a whole, obturator foramen, that is oval and longer in males and approximately triangular and smaller in females. The subpubic angle, which is acute, V-shaped and smaller in males, and in females the subpubic angle is obtuse, U-shaped, and the acetabulum is larger in males and smaller in females. The greater sciatic notch is narrow, deep and closed in males, and this notch is broad and shallow in females. The other characteristics include sacrum, sacral curvature, and lower portion of sacrum. This is inward and downward in males and backward and upward in females. The articular surface of the sacrum extends behind the second sacral foramen. In females, it is limited to second sacral foramen. The ischium tuberosity in males is more everted, whereas in females it is less everted. Crystal breadth in males is more, whereas it is less in case of females. Iliac bones are high and tend to be vertical in males, and it is lower and laterally divergent in females. Last, the true pelvis is relatively smaller in males and it is shallow, oblique and spacious in case of females. The displayed table is showing you the establishment of partial identity from long bones. These bones include humerus, radius, femur. In case of males, the maximum length of humerus is 322 mm in case of Indians, whereas it is 290 mm in case of Indian females. The bicondylar width is 60 mm in case of males and it is 57.5 mm in case of females. When we talk about the radius, the maximum length of the radius is 242 mm in case of males and this is 201.2 mm in females. In femur, the maximum length of the femur is 439 mm in males and it is 412 mm in case of female. The bicondylar width of the femur 79.5 mm in males and 70.5 mm in female. The other two important bones which demarcate males and females are tibia and ulna. The maximum length of tibia is 370 mm in males, whereas it is 358 mm in females. The weight of tibia is 234 grams in males and 156 gram in females. The size of the ulna is bigger in males and it is smaller in females. The maximum length of the ulna is 265 mm in males and This is 230 millimeter in females. The shape of the head of the ulna bone is less globular in males and it is more globular in females. The next source of identification is age. Forensic anthropologists attempt to determine the most approximate age as partial identity from the recovered fragmentary and decomposed remains that will provide age in range such as 15 to 17 years. Forensic anthropologists attempt to estimate the appropriate age from cranial suture, dentition, and epiphyseal union of long bones. The suture of the skull follows a definite sequence and the time of closing by which approximate age of the individual can be determined. Cranial suture which are used in age determination include the posterior, anterior frontale, metopic suture, basilar suture, sagittal, coronal suture and lambdoid suture. For example, the posterior frontale fuses at the age of 1 to 2 months. The metopic sutures fuses around 2 to 4 years. The sagittal suture, the fusion begins around 25 years and it gets completed by 30 to 35 years. Whereas in case of coronal suture, the fusion begins around 28 years and it gets completed by 35 to 40 years. In case of lambdoid suture, the fusion begins around 30 years and it completes by 50 to 55 years. The occipitomastoid suture, in that case, fusion begins around 60 to 65 years and it completed by 80 years. Whereas the fusion begins around 60 to 65 years and completed by 80 to 85 years in case of sphenobasilar or sphenoparietal suture. The teeth eruption shows the definite sequence and time both in deciduous and permanent dentition. Their prediction from the skeleton remains can provide the approximation of the age of the deceased individual. For example, when we see the deciduous teeth, the eruption of the medial lower incisors occurs at the age of 6 to 8 months. The lateral upper incisors, they appear at the age of 12 to 14 months. The first molar, the upper, which includes the upper and the lower part, it appears at the age of 15 to 16 months, and the second molar, it erupts at the age of 30 to 36 months. When we talk about the permanent teeth, the first molar, which includes the upper and the lower molar, it appears at the age of 6 to 7 years. The lateral incisors, they erupt at the age of 8 to 9 years. The first premolars, they erupt at the age of 10 to 12 years. The second molars, it erupts at the age of 12 to 15 years. And finally, the third molar, which is also referred as wisdom tooth, it appears at the age of 17 to the 25 years. It has been established that the ossification or the union of the epiphysis with the respective shaft is the main guide for age.
epiphyses are growth centers separated from the shaft by a growth plate made up of cartilage. These epiphyses fuse to the shaft of the bone at specific age, and thus it can provide an estimation of age. For example, in case of humerus, which is the bone of hand, the distal end of the shaft, it fuses at the age of 14 and a half years. In case of radius, the fusion of the head to the shaft occurs at the age of 14 to 15 years. In the distal end part of the radius, it fuses at the age of 16 to 17 years. In case of femurs, the fusion of the greater trochanter to the shaft occurs at the age of 16 to 17 years. In case of tibia, the fusion of the distal end occurs at the age of 16 and a half to 17 and a half years. And finally, in case of fibula, the fusion of the distal end occurs at the age of 17 to 18 years.
Stature prediction occupies relatively central place both in the identification and anthropological research necessitated by the medico-legal expert. Stature estimation is one of the important parameters to identify individuals and is most widely used in forensic examination. Estimation of stature from different parameters of body are also carried out to establish partial identity of individuals, which can help narrowing down the pool of possible victim matches. Due to the non-availability of complete skeleton at crime scene, in most of the cases, forensic experts are forced to use mathematical models or formulae as compared to anatomical method to derive stature, as it is workable even with a single long bone. Now we will discuss about the reconstruction of stature from bone fragment. In 1935, Muller provided a method for reconstruction of stature from fragmentary remains of long bones. This is done primarily by measuring the long bones and then comparing the measurements with the charts based regression equation or through the use of multiplication factor. The stature of a person is equal to the maximum length of the long bone multiplied by the multiplication factor. The diagram is showing you the measurement of stature from the long bones through the osteometric bone. The presented table is showing you the multiplication factor for stature estimation through long bones. In case of humerus, the multiplication factor is 5.3 for males and it is also 5.3 for females. For radius, the multiplication factor is 6.8 in males and it is 6.7 in case of females. For the fibula, the multiplication factor is 4.5 in case of males and for females it is 4.4. For example, if the maximum length of the femur is 44 cm, then the approximate stature will be 167.2 cm, which is obtained by multiplying the length of the femur by the multiplication factor. Secondary physical characteristics. These characteristics can be identified in decomposed remains and also in the mutilated remains if the soft part for examination is retained. Secondary physical identifiable characteristic for establishing partial and complete identity from fragmentary and mutilated remains include the external peculiarities such as moles, scars, tattoo marks, wounds, occupational mark, etc. Whereas the somatoscopic observation reveals the partial and complete identity from the fragmentary and decomposed remains, and these observations include skin color, eye color, teeth, and hair of an individual. Scars have long been identified as a means to establish identity of individual. A scar is a fibrous tissue covered by the epithelium formed as a result of healing process of a wound or injury. Scars are usually devoid of hair and sweat glands. The scars are caused by the trauma involving the whole skin thickness by any incised, lacerated, crushing, or penetrating injury by fire, burn, or scalds by corrosive acids or electricity or radiation. While describing a scar for the purpose of identification, instead of its uniqueness, its shape, size, and situation should also be recorded. The presented illustration is showing you different type of scar that is caused by the surgery, wound, or injury. The second row diagram shows you different kind of tattoo marks. The tattoo marks are designs effected by multiple small puncture wounds made through the skin with needles or small penetrating tools dipped in coloring matter. Tattoo marks have always been a valuable means of identification. Their presence leads to the identification of the individual not only during life but also after death, as these marks are indelible and they are so permanent that they can be recognized even in decomposed bodies after the skin has peeled off. Tattoo marks many times indicate religion. A tattoo design may be altered, eliminated, or a second one superimposed in an attempt to hide or reveal identity. Now, it should also be remembered that the same design may be found in more than one individual due to same professional tattooist executing the design. The next secondary physical characteristic is occupational mark. It is occasionally possible to infer the probable occupation of the person by the condition of its cloth or by its stains or callosities on his fingers or body. For example, hard manual laborers possess horny, stiff, and rough hands. Tailors have marks of needle pricks on the outer side of terminal phalanges of the left index finger, a callosity on the right middle finger, last joint where the pencil usually rest is seen on clerk. Fingers generally found stained with dyes or chemicals among photographers, dyers and chemists. Again, waxy deposit in the ears and the dust debris from the undernails may give some indication of the trade of the individual, such as coal miners, asbestors, barbers, and workers. The presented image is showing you an example of occupational mark in which the hand of a manual labor is shown. The next source of secondary identification is deformity. Deformities, whether congenital or acquired from an excellent means of identification, and congenital deformities, many a times hereditary, are known to occur through successive generation in the same family and thus provide individuality to conceal identity. For example, extra fingers, toes, web fingers, toes, birthmarks, cleft palate, hair lip, and moles. Acquired deformities such as fractures healing, injuries in bones, leaving unique marks aid in identification. Individual abnormalities of teeth again help in identification. In the presented diagram, examples of deformities are shown. In the first image, a birthmark in a child is presented, and in the second diagram, example of polydactyly is shown. The somatoscopic observation are valid for dead bodies which has soft tissue intact and which is in the initial stage of decomposition. Some of the somatoscopic characteristics used to establish identity of dead and decomposed remains are skin color, eye color, teeth, and hair. The complexion may be fair, wheat colored, dark brown, or shallow. Skin color must be observed at least at 4 to 5 sites of the body, as sunlight, oil, soap, disease, malnutrition, thickness of the epidermis, climate change affect the color of the skin. Hairs present on the body and wrinkles tend to make the color of the skin darker. Eye color is the usual parameter in Caucasoid, then Negroid and Mongoloid races. Colors of the eye are so unique that it can reveal individuality. Teeth are very resistant and bear much useful information as it cannot be decomposed and possess information regarding artificial implants or any other peculiarity. Here, for the identification purpose, examine color, style, length, beard, and mustache. The superimposition photography is new technique for identification purpose, as it is possible in those cases where the skull of the deceased is recovered from fragmentary remains. The photographs of the front and side view of the head of the deceased taken while he was alive and enlarged to the same size as that of X-ray photo of the skull. These positive portraits and the negatives of the skull are photographically superimposed to determine if they tally in contour of the face and skull. Measurements like interpupillary distance, etc. are taken and compared, and the identity of the skull with that of the person in the photograph was judged. The technique is rather difficult but can provide corroborative evidence. Further, the method is of value negatively to exclude a certain person.
So students, now we will discuss about the examination of mutilated bodies. Mutilated bodies may be a result of a criminal act or due to animal bites or because of an accident or due to pathology and trauma or result of natural calamities like earthquake, flood or any kind of calamity or due to man-made disasters like bomb blast. A forensic anthropologist tries to ascertain if the mutilated parts are human or non-human. If the body belongs to the humans, the forensic anthropologist elucidates certain points to conceal his partial or complete identification. All mutilated or fragmentary part should be arranged in anatomical order and it should be determined that whether they belong to one individual or more than one individual. The mutilated parts should be carefully observed and the nature, character and color of the skin, if any, should be described. The manner by which the mutilated parts are separated, such as whether they are lacerated, cut cleanly, hacked or gnawed through by the animals. The sex can be determined from the facial features, body parts, shape of the pelvis, external genitalia, bones, soft tissues like uterus or prostate and mammary glands. The probable age can be determined from the skull, teeth, ossification of bones and color of the hairs. Identification can also be ascertained from tattoo marks, scars, color of the hair, deformities, fingerprint and stature. The probable time since death can be determined from the decomposition stage of the mutilated and decomposed parts of the body. The cause of the death can be determined by observing the presence of injuries on the body and superimposition technique.
Examination of decomposed bodies. Decomposed bodies should be handled with care as features may be altered due to advanced stage of decomposition. Sometimes the body is in such an advanced stage of decomposition which poses difficulty in identification. In such cases, identification was attempted through features like clothes, tattoo marks, and fingerprints. Many a time, forensic anthropologists not able to examine the cause of death and thus they have to mention in criminal reports that due to advanced stage of putrefaction, it is not possible to determine the cause of death.
So students, let us summarize what we have learned from this module. The decomposed and the fragmentary or the mutilated remains many a times alter the features and general appearance of the deceased, that visual recognition even by the close relatives may be uncertain or impossible. It is important to understand that all methods of identification of mutilated, fragmentary and decomposed remains require that a known characteristic of an individual distinguishing him or her from all other antemortem evidence when compared with the same characteristic of the unknown descendant, that is post-mortem evidence. Accomplishment of number of partial identity leads to the determination of complete identity of the individual. Thank you.